Welcome to the Texas Consilium Business Show. I'm Michael Yorba, your host. All right, my guest today is Brad Morgan. He is the Division Vice President of the Dallas District for Kindred Healthcare. Brad, welcome to the show.
Appreciate being on.
First, I want to congratulate you on your nomination with the Texas Consilium Business Excellence Award. Thanks for taking the time to be here on the show and talk to us about what's going on with you, your business. But let's start with that. Tell us about yourself and your business. Give us some color, some background.
Yeah, I appreciate being asked to be on the show and being recognized. It's always nice to be recognized for the work that you do. I think that probably we need to start off with understanding what we do at Kindred Healthcare. I think understanding what an LTAC is one of the most misunderstood things even in healthcare. I came from a background, I was 16 years at Baylor Scott & White before I came over to Kindred Healthcare. And I have to admit, even before I came to Kindred, I didn't really know the difference between what a long-term acute care hospital is and what a skilled nursing facility is. It's very misunderstood, even in the healthcare industry. I think even hospital CEOs and hospital executives don't really understand the full comprehension of what an LTAC is and what it does. And just to make it kind of easier for the audience, the difference between a skilled nursing facility and an LTAC is the level of care that we provide. An LTAC provides acute level care. It's the same level of care that you would get at a regular hospital, meaning we have ICUs, we have the 3-to-1 nursing ratios, 1-to-1 nursing ratios in our ICUs, and we have all the same equipment that you would see in an ICU in a hospital, whether that be a ventilator or high flow machines or anything else that you might think of as high technology. And I don't know that that's very well understood. A skilled nursing facility is designed for maintenance care, and they have 16-to-1 or 20-to-1 nursing ratios, and they don't have doctors in the facilities at all times. Whereas at a long-term acute care facility, we always have doctors in the building, either in person or at night. Sometimes we use telehealth services for that. And so we provide a much higher level of care. And why we exist is, there are some patients that go to the hospital, and hospitals are meant for interventional care. They're meant for people to go there, they get something done to them, and then they go home. They go home in 3 to 5 days. That's how hospitals are designed. And there's just a few patients, maybe 2% of the overall population, that aren't well enough to go home. They need an extended amount of acute level care. Now, we're not meant to be an end destination of care. We're transitional care. Our objective is to get you to the next level of care, whether that be rehab care or a skilled nursing facility, home with home health. That's why we exist. And our demand has gone up greatly in the last few years because it's starting to be better understood why we exist and why we're there. Part of the reason our demand has gone up is we are a big part of lowering the cost curve. You hear about the cost of healthcare is really, really high, and how do we bring down the cost of healthcare? Well, a big part of that is applying healthcare in the lowest cost care setting. And we are a lower cost care setting than a regular hospital. And that's because we don't have some of the overhead that a regular hospital has. We don't have an emergency room. We don't have a plethora of ancillary departments. We don't have labor and delivery and things like that. We have a very concentrated type of care. We have ICU and we have med-surg floors, and that's what we have. And so we're a very specific niche of care that is helping to bring down the cost of care.
Tell us about where your vision is for the business, say 5 years out.
One of the reasons that I chose to move over to Kindred a couple of years ago was the cutting edge, innovative approach that Kindred is taking to long-term care. They're doing things that are different than anyone else in the industry. They are 100% completely dedicated and focused on the quality of care. A few years ago, Kindred went private, and that transaction has helped them to do some things that are different than other in the industries. When others in the industry are struggling financially or struggling with the new criteria for LTAC, Kindred is flourishing, and we are reinvesting in our company. We recently replaced every single bed in our company. We're replacing all the ventilators. We're replacing, and this is probably one of the most important things that we're doing, is we're designing an EMR system that is designed specifically for long-term acute care. Now, what that means is most of the out-of-the-box Eclipsys, Allscripts, the EMR systems you've heard of, they're all designed for regular hospitals. Regular hospitals have closed systems where they talk internally. That doesn't work for us because we have to accept patients from every different system. And so we have to have an open architecture. We need to be able to accept data and accept information from multiple healthcare systems. That makes our EMR system really, really complicated and a one-of-a-kind kind of EMR system. And so we're spending a lot of time. We've already spent a year in development. We're probably going to spend another year in development to make this system work. And this new EMR system, it's going to be open not only to our referring hospital partners, but also to payers and insurance companies so that they can have real-time information on their members and how their members are doing. And it'll help with the authorizations process and concurrent review processes. And it's one of those systems that's going to make us unique. Another thing that's making us unique in the industry is our commitment to quality and doing things that others in our industry aren't doing, like going after disease-specific certifications with Joint Commission. Joint Commission disease-specific certifications are normally gone after by hospitals and regular hospitals, and the LTAC industry hasn't normally done that. Well, we are committed, and every single hospital in the Kindred healthcare system has now had respiratory disease-specific certification, and this year we're going after sepsis certification. And those are some of the things that really set us apart. Another thing that sets us apart is our commitment to advanced specialty care programs. We have created programs like our transplant program is a great example, where we work in conjunction with our referring hospitals, and we emulate their protocols and their processes. So there is a seamless transition from the hospital to our hospitals. And it's the same doctors that are providing care at the regular hospital that are then coming over and providing care at our hospital. And by following their processes and their protocols, there is no change in the level of care when a patient comes over to our hospital. And, other programs like that are the burn program, pulmonary rehab program. We have a neurotrauma program. And it's those specialty types of programs that are setting Kindred apart. We also have other kinds of ancillary support departments that others in our industry don't have. We have committed to working with payers. We have a whole department that is devoted to managed care relationships and creating relationships with the Uniteds and the Aetnas and the Humanas of the world. And we are working with them on value-based care type programs. Reimbursement models are going to change in the future. We're going from fee-for-service to value-based care models, and nobody really knows what that's going to look like. And we are committed to developing those programs and being a part of the development of those programs. Along with that, we have a team of nurses that are dedicated to authorization processes and helping out the families as they navigate the complexities of the healthcare world. It is a complex world, and we dedicate resources to making that an easier transition. I think in 5 years, we will be a more utilized part of the continuum of care. And it will be natural for someone that needs our level of care to go from a hospital to an LTAC.
What makes your business special? I mean, you've given us a well-rounded view of all of the different moving parts that you have, but there's a core essence that makes it special.
I think the thing that makes Kindred special is our focus and our commitment to our people. We have a set of values that we adhere to greatly, and they're simple values, like putting the patient first, doing your best, being kinder than expected. It's just a few of the 6 values that we have, but we adhere to those values, and we try to make Kindred a better place to work, because we understand that our business has to be focused on quality and the quality of care, but you can't provide high quality care if you don't have the right people in place. And so it is extraordinarily important to us that we create a work environment for our staff that is conducive to making it an enjoyable place to work, because we know that happy staff makes for happier patients. And so we spend a lot of resources really putting into our staff. We're conducting right now about 150 separate listening sessions across the organization. And those listening sessions are not attended by the leaders of the hospitals. They're attended by the staff, because we want to know what the staff feels like and what they need. The social interactions of today and some of the different movements that have happened this summer have really heightened the awareness of the importance of diversity and inclusion. Thankfully, we celebrate a highly diverse workforce. And I think that makes us a better place to provide care. Our staff, because it is diverse, is able to empathize with our patients and with our communities. And we are very representative of our communities. And I know that is a very important part of our future. And it is something that we are very, very committed to as we move forward. And I think that commitment to our staff and to our people and making this a better place to work is what makes us a little bit different. And it's going to help us to achieve the quality goals that we set out for ourselves and our expectations.
Now, the Texas Consilium Award of Business Excellence, the criteria encompasses customer satisfaction, operational excellence, employee satisfaction, business performance. Describe how your company exemplifies excellence.
So several of those areas we measure, because if you're not measuring it, you're not paying attention to it. For example, patient satisfaction or customer satisfaction. We participate in Press Ganey. We also participate in rep.com. And that is something that we pay attention to, because we know that the perception of quality is highly linked to the satisfaction. And so we use that as part of our quality criteria. And we pay attention, highly to it. We force rank ourselves, and we compare ourselves we have what we call a 5K ranking. And that's where we compare each of our hospitals to each other, based upon quality performance. And we also have a separate one based upon, patient satisfaction, people performance. And we measure all of those things against each other's, and then we rank ourselves. And it is I think it's a good way of helping to enforce continuous process improvements. And that is another thing that we are dedicated to, is continually improving. And we know that the best ideas for continuous process improvement are generated at the staff level. And we know that it's the people that are doing the work day in and day out that are the ones that are most likely to come up with the best ideas. And so we encourage that type of interaction, and we create systems that allow our staff to provide recommendations on things that we can do better. And we're not afraid to try those things and see if it helps. And when it does, when we do implement those solutions, we measure them. It's very, it's Lean Six Sigma kind of stuff. But we do that because we know that there's always room for improvement, and there's always ways to do things better. And, we're very committed to those types of processes.
If you were speaking to a group of Texas business leaders, and they wanted to improve their own business through the leadership journeys that you've had, what lessons that you've learned would you most like to share?
This summer, it has been one of the most interesting times in healthcare. The response to COVID-19 has pressured the healthcare industry all over the country. And we've learned a lot of lessons about how to be nimble and how to change and how to react. And I think that is a good example of excellence and what we have done to respond to COVID-19. We have continually increased our capacity at our units, at the same time maintaining the safety of our patients. We have the exact type of patient in our hospitals that would be most adversely affected if COVID-19 outbreak were to happen in our hospitals. They are the sickest of the sick. They're that 2% that just can't afford to get infected. And we recognized that when the COVID-19 outbreak happened. And so we had to be innovative, and we had to be intentionally selective on how we were going to implement processes so that we could maintain the safety of our non-COVID patients while at the same time being able to support our community needs. In Texas, we have been hit really hard by COVID-19. And in July, it came on really, really fast. And so there was a lot of pressure on our industry to be able to accept more and more COVID-19 patients. And I'm very happy that we were able to do so and be able to continually increase our capacity. And we were able to do it in a way where we did not have a breakout at any of our hospitals. We did not have infections cross from COVID to non-COVID units. And we did that in a way that I think no one else in our industry did it. We had very intentional quality criteria that we followed, looking at CDC guidelines when, selecting patients to bring in. We also separated staff. We had staff that was committed to COVID and staff that was committed to non-COVID. We had parts of our hospitals that were committed to COVID and parts of our hospitals that were non-COVID, and the two never crossed. And that was very hard for us to do because the size of our facilities isn't like a regular hospital. We're much smaller in nature. And so we had to be creative and innovative in the way that we did it. And, I'm very proud of the fact that we have more COVID dedicated beds in all of our communities in Texas than all of our LTAC competitors combined. And we were able to do that in a very short amount of time.
Good answer. Now, in regards to social responsibility, what is Kindred doing there?
Yeah, I spoke to that a little bit. The Black Lives Matter movement is something that we have talked about openly, within our staff. And it's one of those things that it's hard to talk about sometimes, but it's something you need to talk about. And that's the purpose of our open sessions that we're doing across the entire company. Like I said, we have over 150 of these open sessions that are being conducted, where everyone is encouraged to participate and encouraged to talk about it, because we want to know how we're really doing. And we want to create environments where these open sessions where people are free to talk about things that we can do better to improve the welcomeness and improve our adherence to promoting an environment where everyone feels that they're welcome. We know that is extraordinarily important. And the feedback that we're getting, sometimes it's hard to hear, but most of the time the feedback we're getting is very good feedback. And I think that the staff just appreciates the fact that it is important and we're spending time on it and we're not trying to hide from it, and we're welcoming these discussions.
What do you want your legacy to be?
Personally or for Kindred?
Well, personally and also for Kindred, because you're a director there. You're guiding the ship. So, but you've got but yet you're the human driving. So,
sure. I think that you're going to hear this, and the two answers really dovetail and go together. We're in an interesting time in healthcare. There's a reason I went into hospital and healthcare administration. The pressures on healthcare in this country are extraordinary right now. The demand is increasing dramatically, whereas the supply is actually constricting. There are hospitals that are going out of business. There are financial pressures being put on the industry. And I know that the Kindred motivation is, how do we be a better healthcare partner? How do we be a better part of the continuum of care and help to lower the cost of care while improving the quality and achieving better outcomes? And it's exciting to be a part of that innovation and to be a part of rethinking how we're delivering healthcare in this country. That's exciting, and if you can't get excited about that as a healthcare leader, you probably shouldn't be in healthcare. We're trying to do things better. We're trying to do things more efficiently. We're trying to improve our operations. We're trying to improve access to care for the community. There are large swaths of our communities that don't utilize healthcare resources. And so if we can be a part of creating a healthier community where people are better utilizing primary care, where people aren't having to use acute care as much, those are big, important things. That's how we're going to bend the cost curve in healthcare. It's less utilization of high acuity care. And so as Kindred, our goal is we need to get these patients to where they're not continually bouncing back and reutilizing the system. We need to get them better. We need to get them into rehab. We need to get them home. We need to return them to their baseline health state so that they're not just bouncing back and continuing to reuse resources in the healthcare continuum. If a person is continually going back to the hospital, we're not doing our job to make them better. And so I know that Kindred's committed to making people better and not just treating them over and over again. It's how do we get them better?
Okay, thanks so much for answering all our questions. That concludes today's video portion of this. Again, I want to congratulate you on being nominated for the Business Excellence Award, but stick around. I've got a couple of questions for the voting panel, okay?
All right, thank you.